This is Insight and Beyond, brought to you by Moorfields Eye Hospital Dubai, a podcast where knowledge meets curiosity. World-leading experts in eye care will dive deep into the world of vision, health, and insights in innovation. Each episode is a step into the future of healthcare and more. Tune in, get inspired, and see the world differently.
Welcome to another episode of Insight and Beyond. My name is Katy, and today I'm joined by Tash, who is our lead optometrist here at Moorfields Dubai. Hi.
How are you?
I'm good, thank you. So really we wanted to look into some of the themes of World Sight Day, which is love your eyes at work. So as an optometrist, what does that mean to you?
I think that it's a great initiative because it really does highlight the importance of prioritizing your eye health. I think it's increasing awareness as well, more than anything, especially to try and push people to take more preventative measures to make sure your eye health is nice and stable. Mm-hmm. It's especially important in today's workplace as well.
So you say today's workplace, are you suggesting essentially that the increase in VDU, so computer work-based jobs, has made an impact on eyes? So what is that impact? What is the increase in screen time doing to people's eyes?
Well, I mean, we've had screens for years, haven't we? And I think it's always been an issue, but the fact that it's an increasing problem, even in schools. They're just using screens all throughout the day. In the workplace, we're sat in front of our monitors, and not just that, we go home and we look at our phones all day, all night. That is, in fact, reducing our productivity at work. Mm. So once it starts to reduce our productivity as well, it's affecting how well we're doing at work and our overall well-being. Yeah. So it's a huge thing I keep pushing my patients and keep informing them because I think they forget.
And I guess people probably underestimate how much time they spend with a screen in close proximity to their face. Mm. So people talk about this digital eye strain. Is it a real thing? If it is, can you explain a little bit about digital eye strain?
What's happening with digital eye strain is we're focusing far too long on objects at a certain distance, okay? So what we're doing is we have a mechanism within the eyes whereby we have muscles that contract. It helps the lens to change its shape, and that helps us to focus on objects better. At the same time, we've got our extraocular muscles. They're helping the eyes to move inwards, keep it aligned on the object and the target. So if we imagine with digital eye strain, what's happening is the longer we're trying to stay focused on it, that balance, that simultaneous balance, it starts to get tired. It's essentially muscle fatigue, isn't it? So
it's essentially that we're in an active stage, active response all the time. So it's a bit like holding up a weight for a really long time and expecting your arm not to start aching.
How long can we do that for?
Yeah. Okay.
So it's difficult.
Okay, so how can people spot the signs? And then once they've spotted the signs, what can they do to actually try and manage some of those symptoms?
So with the digital eye strain, typical signs, you're getting headaches, you're getting fatigue, you could get burning sensation, dryness because of reduced blink rate. We don't realize how much we're just staring at the screens as well. So reduced blink rate means instability of a tear film layer. So you could get the burning, as I discussed, the irritation, twitching. That's a typical one with digital eye strain as well. I find that some patients start to get neck or shoulder pain as well. So once you start to spot those signs, those symptoms, you can take specific measures to try and prevent these symptoms.
So what sort of measures would you suggest?
We all know the 20-20-20 rule. We say it all the time here. So every 20 minutes, look 20 feet away for about 20 seconds and make that a habit, a continuous habit. Also, blinking more, as I said. I know that some of my colleagues themselves as well, they have a notification that pops up on their screen. So you can use that as a way to remind yourself, do these things more often. Mm-hmm. Making sure that our posture. So posture is a huge thing that I find as well people forget. If your screen or monitor's not adjusted in the right way, you could be bending back forwards, you could be going backwards a little bit, and that starts to make you focus or put more stress on your eyes. So that
So the ergonomics of it then should be that your knees are at 90 degrees to your hips and your hips, and that your screen is at eye level, because a lot of people hold things down here, correct? So then they're bending their neck.
Absolutely.
Yeah? So lift up their screens is one thing that they can do.
Yeah, I kind of say like just below eye level is great, and then arm's length I always discuss with patients. But if you're really tall, it's person to person, isn't it? Sometimes you have to just sit in your office, see what works for you, but really trying to make it work for your personal needs is the most important thing.
And I think, I definitely tell people the 20/20 rule, but I think one of the things that we also need to just remind people to do is just to get up, right? So if they get up and have a walk around, they naturally start to blink a little bit more. They're just changing those environmental impacts. Okay, good stuff. So the other thing that we hear a lot of, I think, within a workplace is blue light and the dangers of blue light on your eye. Can you just give us a bit of a lowdown on that? Is it a myth? Is there any truth to it? What would your opinion be on that?
I think a lot of us here agree that it's more of a myth. Why I say that is blue light is everywhere. Okay, so we're more exposed to it just by the natural sunlight, aren't we? The amount of blue light coming out of digital devices is far less than even that natural sunlight. So it's not going to do a damaging effect when we're in front of the screens, but it does have an effect, let's say, if the extended amount of time you're spending, maybe more at nighttime, because we know that blue light effect is more affecting on our sleep cycle, circadian rhythm.
Yeah.
So I suggest before bed, try your best to avoid the screen, any digital device as much as you can, which is difficult, even for me. I don't do that. But my husband, for example, he has a pop-up that will come on his phone and it's sleep mode. Yeah. And once that's on, that's it. So that in itself will help not to disrupt your sleep, level out your melatonin levels. So I think that's the most important thing to take away from blue light instead of in front of the devices as
and I guess it's not just the blue light as well. We've all been there. If we get an email late at night, that it then keeps you up at night. It's the stimulus.
We're probably the worst people
of the actual what you're actually looking at as well. But it's so difficult now because a lot of people use their phones for their alarm clocks to see at night. So I guess the blue blockers. Then is there any purpose of them? Do they hold any position in your treatment plans?
You can, if you're someone who needs to maybe work at night, even time zones in this region, you may be working towards the night time. You can use the blue light filter if you want to, but I do think it's sort of a marketing ploy as well, isn't it? I don't like to tell my patients you must have it.
Yeah, absolutely. It's a bit of a placebo effect sometimes to these things.
And also I say to patients, look, it doesn't replace. Maybe you might think, I'm going to put these blue light glasses on and I could spend maybe 15 hours in front of the screen. It's going to save me. It's going to reduce digital eye strain. It won't. It's not going to really focus on that muscle fatigue. Yeah. You need to take regular breaks. Yeah.
And what about, so obviously in this region as well, we have the AC on quite high generally, especially at this time of the year. What kind of effect is that having on our eye health at work?
ACs, as we know, it can dry our tear film layer out. So it's evaporating the tear film. And if it's facing our eyes, we don't want that. If you can control it, keep it away, directing from the eyes. That's one massive thing, I say. Also humidifiers. I don't know if we use that. Well, I do think it could help add moisture to the air as well. So that's a good.
Yeah, and I think the other thing that people, just to get that understanding of how it dries the eye, is when you're in the car, people often will say that their eyes become watery or dry or watery in the car because the AC is often pointed at faces. Yeah. Interesting. Okay, so we're at work. We've got patients that require glasses. Would you prefer your patients to be wearing glasses or contact lenses when they're at work, or is there no real difference between the two?
For me personally, I would say don't just hold one option for a patient, because where we may know the benefits, the pros and cons, a patient may say prefer contact lenses because they've got a high prescription. We don't want to deter them from wearing that. although we know that wearing contact lenses dries our eyes out more. So that's the only issue with the lenses. But I wouldn't say don't wear it. It increases your peripheral field of vision. There are great benefits for contact lenses. So glasses, yeah, they're brilliant. They're convenient. Take them off whenever you need. But contact lenses, there are certain things you can do that I'd advise patients. So where we're discussing digital eye strain, dry eye, irritation, talk to your practitioner about contact lenses that are highly moisturizing, allow more oxygen to the surface as well. That's a huge thing, because as soon as you've got a lens in front of the eye, what tends to happen is you're blocking the amount of oxygen that can come through to the cornea, and that's reducing how much we can keep that eye healthy and hydrated. So silicone hydrogel contact lenses are a great option. Daily disposables, I always say to patients, I love daily disposables. They're less chance of infection. They don't carry the bacteria, the allergens or protein deposit buildup. So they're a much better option for you. And definitely another one, as soon as you're out of the office, take your lenses out.
Yeah.
Many of my patients will say, Tasha, put the lenses in at 6 a.m. and they're out at 9 p.m. And I'm like, oh.
Yeah. Or when they go to bed even later sometimes. Yeah.
And it's.
So what's that doing to somebody's eye if they do keep their contact lenses in for that length of time?
You'll be drying the eyes out, causing more irritation to the surface. So that in itself can cause blurry vision. You don't want the redness, the burning sensation. So that's why we say try and keep them out as soon as you can.
So what sort of time, so how many hours a day? If I was your patient, how many hours a day would you suggest I wear my contact lenses?
Typically, I say about 12 to 15 hours.
Okay, it's longer than I thought. Okay.
But see, we need to be realistic as well. So how long are we in the office for? I'm in 7 a.m. till 5 or sometimes longer. To ask a patient to take them out, it's kind of irritating, isn't it?
Yeah.
But use artificial tears with the contact lenses, preservative-free.
Do you have to use specific artificial tears for contact lens wearers, or can you just use the ones that you just get over the counter?
Yeah, no, you do have to be careful. Talk to your clinician, ophthalmologist, optometrist, ask them. But when you go to pharmacies, there are options for the drops that you can use with contact lenses specifically. So you've got to be careful with that as well.
Okay. So next age bracket of patients. So I am now delving into this age bracket where things are starting, my arm is not quite long enough, and in dim lighting I'm starting to struggle to see smaller print on my screens and things.
Yeah.
What is happening to me and what can I do about it?
So we call this change presbyopia. Happens to nearly everyone. We can't avoid it, and it's a natural, irreversible change that starts to occur.
But you can say it. For what reason? So
everyone's
natural aging.
Say aging, yeah. I mean, so look, when we're young, we have nice, soft, flexible lens in the eye. And that flexibility allows the lens to change its shape, change its curvature. So then once the light hits your eye, you can see a nice, clear image.
Yeah.
As we get.
So this is what you were saying earlier about the accommodation, about the lens squeezing up when we're looking at something close.
Yes.
And so essentially my lens now is getting too firm to do that.
Stiff.
And okay.
More stiffness, less flexibility. We know what's going to happen. The lens will find it harder to change its shape, change its curvature. So you're going to find it difficult to focus as easy as you did maybe 10 years ago.
Yeah. So I'm really only noticing it in dim lighting at this point, but I know that it's likely to worsen. I do have friends and colleagues who are avoiding getting glasses because they think they'll become dependent on them and it'll make things worse. Is that a myth or is that true?
It's a myth, because what happens is you become less tolerant to that blur as soon as you get the glasses. It's helping your eyes and you can't avoid it. So you will eventually need it.
And it's going to progressively get worse, whatever I do, because that lens is going to continue to get more
Your
firm.
Focusing power reduces, doesn't it? So you do need to depend on it at some point. For me, though, personally, I'm very particular. I won't just push people into glasses immediately. So you have to be careful prescribing. You don't give glasses if they're fine still and they're managing. Yeah. Like you say, low lighting levels. Okay. Got a torch.
You've got your torch at the restaurant, which I see lots and lots of people doing now.
Absolutely. Unfortunately, you can magnify text. Yeah. I mean, push your arms out as far as you can.
Yeah.
It's not ideal, but you can adjust.
And then, so I had refractive surgery many moons ago now, and I'm not keen on getting glasses again because I've gone through all of this to get rid of my glasses. Are there any other options for me apart from glasses at the point of requiring something to help me with my reading?
Absolutely. So contact lenses, for example, we can get you into contact lenses. If it depends, we could do just distance and then essentially you wear glasses over the top, which defeats the purpose. Monovision contact lenses can help correct.
What does that mean?
Monovision is basically when one eye, your more dominant eye, is corrected for distance and then your less dominant eye for near.
Okay.
So what we're doing there, though, is you really need to let the image fuse because there's a compensation happening there. And I always tell patients, don't start to go like this over one eye because you'll lose that focus, that fusion.
Yeah.
So it's a great method and it works really well in my clinic. I've fitted loads of patients with it and they're happy, but you may have a depth perception issue. That's one thing to watch out for. There are multifocal options as well. So just like progressive glasses, you've got different rings or zones of a range of vision. So with those, you can have a seamless sort of natural switch between the different distances you're focusing at.
But I'd imagine there's some level of compensation with all of these, right?
Absolutely.
There's no perfect method of managing it.
Yeah.
So with the contact lenses, going back to that one, would it be better to start early on so you're doing small increments to get your brain used to the two different
You can do, yeah.
eyes, or you can just start that anytime?
The monovision correction, you want to be careful because if it's a really high addition, like you're further on, it can cause more issues.
It's going to be more of a
adapt.
jump, right? Yeah, exactly.
And I'd say potentially you may not be suitable for monovision. So that's really more, it's increased chair time, talking to your practitioner, finding what's suitable and trialing it.
Now we've kind of covered how to keep ourselves our eyes safe and healthy at work. If you could pick your 3 top tips for healthy eyes at work, what would those be?
20-20-20 rule for sure. That just being more conscious and stepping back, leaving your chair, having a walk around and looking at 20 feet, giving your eyes that regular break, that will sort of break that muscle fatigue and that tension. So that's great.
Yeah.
Blinking more for sure. So you can moisturize your eyes and make sure there's no disruption to the tear film layer. And also posture, like I said, because we forget how important that is and how it affects us. So really be mindful of where your screen is kept and the distance and the height.
Yeah, and the desk height and the chair height and everything. Yeah, okay, good to know. And then what one myth about eye health would you like to bust today?
Myth that I hear a lot, it's I've got great vision, so I don't need to get my eyes checked.
Yeah.
So you can see really well. They don't have symptoms of anything. For me personally, I always say to patients, still go and get your eyes, your ocular health checked, because there are ocular diseases that you won't have symptoms for. And you need an ophthalmologist to be checking your retina, the back of the eye, your front surface. Super important to get regular checkups.
Yeah. And obviously there's a lot of systemic problems that can show up in the eyes first.
Yeah, absolutely.
That's right, isn't it?
Diabetes, we have done that before where we've done a full checkup on a patient and they have shown signs of maybe diabetes, hypertension.
That wasn't diagnosed
before. So the eye, it can really show a lot.
It really is a window to your health.
I was going to say that.
Exactly. Good stuff. And so what sort of timelines would you think for checkups? So, when we're thinking about children, we're thinking that those really early on checks at sort of 6 weeks, then 3 years. But if you're an adult and you haven't had your eyes checked for the last 5 years or so, what would you say, just once a year, once every 18 months? What would your normal timeline be?
I'd say once a year for sure, absolutely. And then depending if you've got systemic disease, maybe a little bit earlier. If you're under treatment with your ophthalmologist earlier, children 6 months or so. It depends on the age group, your general health, and if there's anything going on with your eye health. But every year, 100%.
Yeah. And that would be with an ophthalmologist here, yes?
Ophthalmologist here, yeah. And optometrist, I'd say Your ophthalmologist will advise you if you need to get your eye numbers checked.
Yeah.
If you have symptoms, definitely come over to the optometrist as well.
Yeah. So your optometry is essentially your need for glasses, your prescription. You will manage all of the contact lenses, glasses, prescriptions. What are there any tips for actually choosing glasses from your point of view that would be good for specifically for those who are in a working environment? Are there any coatings or anything that you would suggest for the prescription that they do have?
I always say anti-reflection coating for sure, to cut out any glare. 100%. That's the main one for me personally. You have so many options out there, and so when you're speaking to your optometrist, keep your conversation as transparent as you need to. So what I mean by that is your occupation matters, your lifestyle, your hobbies matter.
Yeah.
You could be someone who plays golf, paddle, you need contact lenses, so certain things, because there are so many options for progressive lenses as well.
Yeah.
Now as well, there's a lot of AI within technology and new progressive ways to measure the right progressive lens for you. AI technology can measure your pupil in different lighting levels, which has a huge impact on our vision as well. So when you go to your optical shop or dispensing optician, they can really help master which type of lens you need.
So it's much more personalised care nowadays.
Yes, yeah. And even office lenses, which I don't want to forget to mention, because office lenses a lot of people don't know about. They're specifically made for those that maybe just want vision in front of their computer and just veneer.
Yeah.
Working from home, they don't need to see other people. So they just want that. And they maybe not even wearing glasses all the time, literally just in front of the...
So they just put them on when they're doing their computer and their work.
So many options. Just talking to your optometrist and getting the right advice and knowing your options is key.
That's great. I really think we've covered so much for World Sight Day on keeping our eyes healthy at work. So thank you so much, Tash, for joining us. And thank you all for joining us for another episode of Insight and Beyond with Moorfields Eye Hospital.